Welcome to the Armor Men's Health Hour with Dr. Mistry and Donna Lee.
Hello and welcome to the Armor Men's Health Hour. I'm Dr. Mistry, your host, here with an excellent sound engineer and producer, Donna Lee.
I'm trying to keep you on time and on schedule, and you're making it very hard for me.
You know what I like to do?
Mess with me? Talk. And mess with the time.
That's right, I do like to talk. I'm a board-certified urologist. This is a men's health show. Mm-hmm. Our urology practice is called NAU Urology Specialist. We've been in Austin.
North Austin Urology.
That's correct. And hopefully one day it'll change to a name that makes some sense.
It'll be all over Texas Urology. Continue.
All over Texas. We are the second biggest urology group in town, which means we try a little harder.
That's right. And we're cuter on the weekends.
That's right.
We have pushed up boobies, pretty lipsticks.
We have offices all throughout Austin. And Donna, where are our offices and how do people get a hold of us?
We're in Round Rock, North Austin, South Austin, and Dripping Springs, Texas. So you can get a hold of us during the week at 512-238-0762. And our website is armormenshealth.com. Our place to send questions is armormenshealth@gmail.com. And we have a special guest who's very near and dear to my heart.
That's right. That's right. Shawn Elander, you're an FNP or nurse practitioner at Victory Medical. Is that right?
I am.
And you're one of our, you send us patients all the time. I love your insight. You're just a real smart person, and
with great questions.
And just somebody who I really appreciate co-partnering on case care with you.
Well, thank you. I appreciate that.
So, Shawn, what I wanted to talk to you about today, especially at the time of one pandemic, was that there was a pandemic that kind of shaped my medical career too, and that was, not exactly a pandemic, but the AIDS epidemic.
Correct.
And when I was first training as a medical student, we still had many, many patients that came in that were HIV positive, that either had AIDS or had HIV-related illnesses. And we had limitations on what we could do. We couldn't, as a medical student, you couldn't participate in some of their surgeries. And there was a real fear. And then it just seemed to, go away.
Oh, did it go away?
or something, like the fear went away.
Right. And kind of like coronavirus. Like everybody was scared to death for a few months.
No, they're still scared.
They're still scared.
They're still scared.
That's true.
Just you.
Just me?
That's
okay.
Right, that's right. Just
I'm
you.
tired of being scared.
That's you. That's all because you know where to get a vaccine easy.
That's Victory Medical.
That's right. So I thought you could talk to us about just the HIV kind of, your experience with the disease process, where you think it's at right now, psychologically, where are people, and then I'd love to talk about prevention strategies.
Well, fantastic. So HIV numbers have definitely decreased over the years, which is a great thing. Bad thing is the numbers are starting to increase again. People are getting too complacent, which is a bad. So in 2012, there was a new drug that was put on the market. It was advertised as a gay HIV prevention medication, and FDA later approved it in the next year for men and women, heterosexual and homosexual. And it wasn't until about 4 more years after that that the Gilead manufacturer really made a big splash and starts doing all kinds of marketing for it. Truvada and now Descovy, the two medications that are used for HIV prevention. It's a daily medication somebody can take, and it is 99.7% effective for prevention of HIV when taken appropriately.
So with these medicines, when I talk to people who are at risk, we're talking about men who often are having sex with men and want to make sure that they don't contract HIV. But the treatment for HIV itself has also seen some incredible improvements. Is that right?
Oh, most definitely. When I was first in school way back a few years ago, working with HIV patients, we're talking 30, 40 pills a day. Now it's down to 1 small pill a day for HIV treatment. It's also moved from infectious disease treating to now I'm treating here in primary care as well.
And it's more of a chronic disease management.
Correct.
And many patients have undetectable levels.
Right. Most people that are on any of the HIV medications that are available now do become undetectable, typically within 6 to 12 months.
Now, just because we have a good treatment for it doesn't mean that we shouldn't try not to get it.
Correct.
Good point.
Exactly. As I tell my patients, if you're going to have sex, great, hallelujah, that's your choice. I'm here to help you out and make sure that you're using smarter choices overall. so that you're not getting any STDs. Like Austin right now is higher than national average for STDs, especially syphilis and HIV. So if we can use PrEP or condoms or smarter choices overall, then we're going to get people to...
It is one of the...
It is the live music capital of the world.
And one of the drunker cities. So they're just not making good decisions, Shawn.
Exactly. And the other number that should scare people is...
We also have Congress here.
That's right.
True.
The other thing that should scare some people is after gay men, the number 2 group getting HIV is 13 to 35-year-old women. So all that means they've got to be getting it from somewhere. Oh, that's right, from heterosexual men. So women are getting tested, men aren't. So
That's interesting.
Wow.
So I'm getting more and more women also on PrEP therapy as well.
Well,
Okay.
I think that if you think that you are at risk for contracting HIV through your lifestyle or through or you think you're at risk, is there advanced testing that's necessary before you start on these medications, and are they covered by insurance?
So we typically test for HIV that day. We also check kidney, liver, and urine, and we watch for hepatitis B. And that's it. It's real easy. Austin is becoming one of the fast start cities for HIV treatment, as well as fast start for prevention therapy. And then we also have post-exposure prophylaxis. So if you come in contact with a known or unknown possible exposure of HIV, we can get you on post-exposure therapy immediately.
So that's very interesting. So if you've been exposed to HIV and you know about it fairly quickly, how long do you have before these exposure therapies no longer are effective?
72 hours is what we're hoping to get it
wow.
on. That's where the most effectiveness is.
And how long do they take it for?
28 days.
And what's the effectiveness of those?
It is 99.8 or something like that.
Wow.
That is amazing.
That's
It's
incredible.
really, really high.
It really tells you what the medical community can do when given sufficient time, space, and financial capability to make progress. That is, 25 years ago, you wouldn't have believed that we would have such a control over this disease process. It's really amazing.
That's right. So even 25 years ago, becoming sexually active, and then, you get tested for HIV, you're not going to find out for 2 to 4 weeks and be worried the whole time. And now we can find out in days, and we can take preventative. It's a great time.
So besides this particular topic, and there are 2 medications that you mentioned, Truvada and Descovy. The Descovy is the more recent one, and I understand it has fewer side effects. Is that right?
That is correct. So Truvada was the first one that came out by Gilead. It's going generic this month. We have no effective studies on it, effectiveness studies. Then the Descovy came out last year. Descovy is a smaller pill overall. It also has less risk for kidney issues as well as bone density loss.
So that's really good for people to note, and you should be taking these medications under medical supervision. So please don't go buying it off the street.
That's right.
Or some website in China.
That's right. I mean, you should know these medicines can have some potential side effects. I assume you need regular HIV testing while you're on it.
That's correct. Every 3 months.
And you need to make sure that you're getting the right advice. And Shawn, I'll tell you, I find you to be such a smart, engaging practitioner. You see things besides this, right? What does your traditional medical practice consist of?
So I see a lot of the typical cough and colds. I see the high blood pressure, huge amounts of diabetes, but then I also treat men hormones and HIV, and then PrEP as well.
That's amazing. And you're part of Victory Medical. And how long have you been with the group?
11 years now.
That's pretty good.
I remember when I first met Shawn. He was very nervous and wearing a suit.
Was he?
Yes.
Oh my God. I thought I was going to pee my pants.
He's so nervous, this guy, but turns out he's a perfect fit for Victory Medical and all of their service lines.
And someone who provides amazing care to patients. So if people are interested in learning more about what you talked about on the radio show or seeing you as a patient, how do they get a hold of you?
You can call our office at 512-462-3627.
Also, DOCS. 512-462-DOCS.
We may steal that.
We're going to steal that and change ours to DICS. And the website is victorymed.com.
It is.
That's right.
And Donna, why don't you tell people how to get a hold of us and how to make an appointment with us?
You can call us during the week at 512-238-0762. You can send your questions to armormenshealth@gmail.com. You can also send Shawn Elander a question if you'd like as well about what you've just heard. And you can check out the website, armormenshealth.com. Did I say that? I feel like I said it
and
twice.
there's a Facebook thing.
There's a Facebook page. Armor Men's Health is our Facebook page. Do we have Twitter? I don't even know anymore. And then you can listen to our podcasts. Wherever.
We're free and worldwide.
We're worldwide, free podcast. You can listen to Shawn Elander. Thank you so much, Shawn, for joining us.
Thank you for joining us, Shawn.
Thank you.
The Armor Men's Health Hour will be right back. If you have questions for Dr. Mistry, email him at armormenshealth@gmail.com.